It's time to once again ask the expert. Back to answer your questions live on air, psychologist Dr. Katherine Kuhlman. Dr. Kuhlman, we're going to talk some answers real quick. Our first question comes from Jalen in Mesa. He says, I have experienced a lot of traumatic events in my life. It seems like it is constantly one thing after another. What tips do you have to help me navigate the feeling of hopelessness? How can I stay afloat? I know a lot of folks probably feel like this when they do go through so many traumatic events.
It's a really great question, and when you go through something like that, it's easy to feel like the world is against you, which is where that hopelessness comes from. And what I recommend for people is, I hate the term the new normal because that's kind of what we used a lot during COVID, but that's exactly what we have to do, is that we have to see each event as the next chapter of our life. And I suggest therapy to anyone who's gone through something to help kind of really dig in and work through a lot of that stuff. There's a great term out there. I suggest you look it up. It's called post-traumatic growth. And it's the idea that we can experience all of these adverse events and all of these really horrific things, but they can actually kind of form us into better human beings, kinder, patient, more spiritual, better relationships with people. It's a great way to look at things.
Interesting. I love that. Looking forward to that next chapter as that loss. All right, Martin Peoria, what are the top 3 things you should be looking for when you become diagnosed with PTSD?
That's a big question to ask. The big things are some kind of re-experiencing of the event, and that can be either through intrusions, which is constant memories. It can be through flashbacks or nightmares. That is something that's required. It has to be incredibly distressing in fact that like the symptoms that you're experiencing create some kind of impairment through either work, relationships, or your social home life, for example.
Yep.
And the final thing that I would look for is that kind of withdrawal, not wanting to be around people, that fear of either going out or avoiding something that maybe caused you a lot of pain in the past.
And you said it's going to look different for every person.
Exactly.
All right, our last question, Dr. Kuhlman. Susan from Gilbert says, what are the best ways to treat kids who may experience PTSD because they're not absolved from it as well?
No, and the way that you'll also see it in kids may be a little bit different. You might see things like acting out behaviors. You might see, some concerning drawings or stories that they're telling. Bedwetting, especially with kids that have experienced some kind of sexual trauma. Get your kid into counseling as soon as possible. Make sure they have a really great support system. Get them involved in activities. But the counseling is going to be the very most important thing that you do.
All right, Dr. Katherine Kuhlman, psychologist, thank you so much for taking the time to speak with us about the signs, the symptoms, and the treatments available for PTSD. We greatly appreciate your time.
My pleasure.
Here on 12 News at 4 o'clock. Up next,